And I think one of the most important things to be is compassionate to yourself and your situation. So when you get diagnosed with cancer, you're going to go into shock. Sometimes it can take 6 months to a year to move through that shock. And I think that's important to hold in mind, because it's, you know, you need to adjust your expectations about how quickly you can actually cope with the experiences that are happening. A lot of times people may have even finished their first round of treatment before they even begin to accept the diagnosis, because they're actually still in shock. Most people go into what I would call survivor mode, where you're not actually processing what's happening to you. You are just having to get through the treatment and get through scans, get through consultations. So again, you are not necessarily processing the experience. And this is where trauma can come into play. So I don't know if any of you have heard of someone called Dr. Dan Siegel. He does what we call the hand-brain model. And I'm just going to see if I can switch my screen slightly so I can see whether or not you can see me. This, I'm just going to run through it really quickly. He does it far better than I do. And the reason I'm going to do it is it shows you how the brain is structured and how your anxiety moves. So if you take your hand like this, think of this bit as your brain stem. So this is the oldest part of your brain. This is where your fight-flight response originates. Then we have what we call the limbic system. If we're being correct, it would actually be 2 thumbs, but we only have 1 thumb, so we use that. This is where your amygdala sits. This is your alarm system. So it takes the information that your brainstem has put in, it sets off the alert status in your brain, and this is where your emotions to anxiety, also your physiological responses. So, you know, an anxiety attack can feel like a cardiac arrest. Really, really powerful. And the symptoms that you can have from anxiety in terms of emotions can be chronic, they can be long-term and really significant. You know, it affects our pain regulation, it affects our sleep, our digestive system, affects our immune system. So, you know, anxiety, it's serious stuff. So all of you will have experienced it and be experiencing it. So that's why it's important you know how to regulate it. Then around that comes our frontal cortex. The important bit in our frontal cortex is, if you think of the nail bed as like our prefrontal cortex, integrates our brainstem, our limbic system, our cortex, even our social environment. So what we're doing in psychological therapy or in our daily life is really trying to activate this prefrontal cortex. Because if we activate this prefrontal cortex, what it's going to do is help us integrate the trauma, help us manage and regulate the anxiety. So things like cognitive behavioral therapy that you've heard of, mindfulness, all of these type of techniques are utilizing this prefrontal cortex to try and sort out this limbic system and sort out our very basic signals that are going through our brainstem. So hopefully that gives you some idea of the structure that's happening. But the reason I talk about it is that anxiety isn't just a feeling. It's actually a whole physiological response. And sometimes when we understand what the brain is doing, it can help us understand what's happening. The other bit of the brain, which can be helpful when we're talking about trauma, is the hippocampus. And you've probably heard of this. This is our memory. It's our filing cabinet. Now, when we have a normal memory, what happens is we have usually a date stamp, we have a really good sequence of events, and our brain knows what to do with it, and it files it away in our hippocampus. The difference with a traumatic memory is that it doesn't go through the same process. It just gets fired off by this limbic system. So it won't necessarily have a date stamp. It won't be in any kind of sequence. We might not even have any sense of when it happens. And so this is where things like PTSD emerge, because we have all these traumatic memories that the brain hasn't processed, it hasn't sorted out. And all that happens is that it fires off this limbic system. So when we're thinking of trauma, the important thing to remember is that not all trauma results in traumatic injury. And the difficulty with the human experience is that we don't know what events will trigger trauma. Some people can cope with one event, other people can't. And something which can seem hugely significant, you might manage really well with, and then 6 months later, something really small can trigger trauma. And the reason that I'm saying this is that it's about you being compassionate again to yourself. So just because someone else you know found a treatment easy doesn't mean that you're going to find it easy. Just because someone else adjusted to a diagnosis doesn't mean that you are going to. The thing to bear in mind with trauma is that there is an accumulative effect. So if you've had a really bad time anyway, regardless of cancer, you're more prone to having traumatic injury. If you get a diagnosis in a period where maybe life is going really well, you're really well supported, you've got a better chance of coping well with that trauma because you have the resources already built up. So again, this makes diseases like yours, where maybe you have a chronic situation, so you have periods of good health and then periods of poor health or ongoing treatments, even harder. Because if you think about what happens with trauma, for a lot of you, those signals are never getting turned off. That limbic system is constantly being activated. And so you are more likely prone to things like PTSD or fatigue. You know, PTSD and fatigue are protective mechanisms. So, you know, that's your brain going, you can't cope with anymore. So, you know, that flat effect, that feeling of tiredness, of disengaging, that's your brain trying to protect you. So the difficulty with all of this is, you know, how do you sustain yourself? How do you manage everything that's going on? And, you know, sometimes the best place to start is with your basics. So what we want to do is to use your prefrontal cortex and also think about what we call your parasympathetic nervous system. So your parasympathetic nervous system is the bit that if you do your breathing, if you do your visualization, if you're doing your relaxation techniques, that's activating your parasympathetic nervous system, and that's helping to turn that alarm off. It's helping to deregulate your sympathetic system. So when we wake up, we are all naturally in high alert. That's how all of us wake up as human beings. With the challenge of something like COVID, or if you're going for a scan that day, or both these things are happening, is that you're not able to turn that alert system off. So, you know, a really good thing to do is to think about when you wake up in the morning, are you doing something to activate your parasympathetic nervous system? It could be a hot shower, it could be a breathing exercise, it could be looking out of the window at your garden, or actually going out into your garden. Think about how you regulate yourself at the beginning of the day. And then really what we're looking at are things that you do throughout the day that help activate that parasympathetic nervous system and help you utilize your prefrontal cortex so that you can sort out what is going on in your limbic system. And so when we talk about cognitive behavioral therapy, a lot of the work around anxiety is to actually see whether or not the signals being fired off are correct. The challenge when you've got your type of disease is that you lose trust in yourself, in what you've been told, and you find it very, very hard to rationalize where you're at. And that's where that uncertainty becomes really hard to manage. So as much as possible, if you can, and I'm not saying this is easy because I don't think it is, stay in the present moment. And sometimes it can be really helpful to think about what you know now, what evidence you have now. What is it that your consultant told you? What is it that's happening right now? You don't know what the future is. Nobody does. So if you allow your thoughts to take you there, it's very, very hard to rationalize. So if you can bring yourself back to the present moment and try to do something with the worries that you're having. You know, if you've got a worry about what will this treatment do to me, see if you can formulate that into a question to ask your consultant, rather than allow yourself to be carried away by what we would call thinking errors, where you begin to catastrophize or begin to think in terms of, well, I don't know what will happen, and go down this awful sort of anxiety spiral. Yeah, so see if you can bring it back to the moment and change that worry either into a question, or see if maybe that worry, you can think your way out of it. You can rationalize your way out of it. Some people find having what we would call worry time really helpful. So this is where you schedule into the day say 10 minutes, 15 minutes of a time where you give yourself permission to worry. And any worries you have outside of that time, you say, I'm not going to worry about it now. I might make a note of it in my notebook, but when I get to my worry time, that's when I can actually think through it, see whether or not it's a valid worry, see if there's anything I can do with it, rather than constantly distract away from it. So that's a way of managing it. If you have lots of worries at bedtime, it can be really useful to have a notebook where you download into the journal. Some people are more non-verbal than verbal, so you can draw, you can colour if you don't want to write it out. If you don't like writing, or it's difficult, or drawing, you can do voice memos on your phone, anything that helps sort of empty out the anxieties from your mind. You don't have to do this at bedtime, you do it anytime, but you know, think about yourself, where your routine is at, what works for you. On top of that, you know, just to kind of go back to, you know, I presume most people have heard of mindfulness and relaxation techniques because a lot of it is out there, but it's actually really, really important. It's one of those techniques which we know works. What I always say to people is that it's not a skill that you're born with. As I said, depending on where you sit on that anxiety spectrum, some people are going to find relaxation techniques a lot easier than others. The more high anxiety you are, the harder you're going to find these techniques. There are apps like Headspace, Calm, Breathe. The NHS has some really good videos and free audio scripts. Find something that works for you and just say to yourself, all I have to do is a minute a day. I always say to people, start out with something that's really achievable. Don't start trying to do a 20-minute meditation. Yeah. The other thing to bear in mind is that prayer, for example, is just as effective as meditation. You're utilizing the same bits of the brain. So if prayer is something that feels very accessible to you, it's part of your practice, use prayer as part of that routine if you're not already. And what some people find helpful is to do, and is to kind of what I call bookending. So you do a relaxation at the beginning of the day to help deactivate your anxiety, and you do one at the end of the day to try and deal with any anxiety that's been triggered. And I'll be honest, during COVID, everyone will have what I call pervasive anxiety. So nobody's going to be without anxiety. And I think that's why it's so important to think about your daily routine. The other thing that if you're not already doing, and again, you know, it varies for everyone, is exercise. Exercise is so important in terms of mental health. So when we're saying exercise, you know, I'm not saying you have to go and run a 5K, but I am saying you need to do a walk. You need to do something, because there is a physicality to anxiety, and we want you to be thinking about muscle tension as much as possible and helping your body to work the way through that. So if all you can do is a couple of minutes walk, that's fine, but do make it part of your routine and make sure you do it. And think about using people in your family or friends to help enforce that routine. And so really what we're looking at are daily activities to help support your mental health. So an ideal routine would be that you get up at the same time every day, you make your bed, you get dressed, you do some kind of relaxation, then you possibly have exercise at some point, you have a social engagement at some point, whether that's remotely or doing a distance walk with a friend. So you begin to see that your day is active, engaged, things are happening in it. The other thing to bear in mind is your bedtime routine. So what we call sleep hygiene is really important. So in an ideal world, you would not be utilizing any blue light devices in the last hour before bedtime. No phone, no television, no laptop. So if you're using those devices for audio, you would turn the screen away from you. Some devices you can switch the blue light off, but again, we wouldn't really want you engaging with the screen because they're stimulating to the brain. So what they're going to do with any of the worries you have is activate them or even trigger new ones. So ideally, we want you going to bed before midnight. Generally speaking, we sort of say sleep before midnight is worth twice that after midnight. So even if you can't manage, too many hours, at least try to aim for 11 o'clock, something like that, which means you're probably going to be starting your sleep routine at 10. And think about what your sleep routine involves. Is it reading? Is it journaling? Is it doing some relaxation? Is it a hot bath? Think about how you can begin to build cues to your brain to trigger sleep. Because we do, behavioral cues are really helpful for your brain knowing and what's expected of it. So, ideally, we're going to bed at the same time, we're getting up at the same time. We've got these things throughout the day which are going to help us regulate our systems. And, that's giving you a really good foundation for mental health and for well-being and to cope with the difficulties that are happening. That's not to say that you're not going to experience anxiety. You are. Things like scans are going to trigger anxiety. Someone said end of treatment. We know for a fact that everybody has heightened anxiety at the end of treatment for the very reasons you said, because you're no longer doing something. So you can sort of begin to predict when you're going to have anxiety difficulties and you can plan for it. The other thing to bear in mind is that we know post-treatment, people are more prone to post-traumatic stress disorders. And we can get PTSD 6 months to a year after the event itself. And so it's important that you know what PTSD looks like. It's nightmares, flashbacks, it can be behavioral changes, frustration, anger. If that's beginning to happen, that's when it's really important that you get yourself assessed. The other thing that I'm also going to mention is to also consider antidepressants, because they can be really, really helpful. If you've had an extended period where you've had low mood or acute anxiety, what can happen is that there's an imbalance in the brain chemistry. And behavioral techniques aren't necessarily going to be enough to correct that imbalance. And that's where antidepressants can be really helpful. I'm a psychologist, so I concentrate on behavioral techniques. And what I can say is that, if you are presenting with acute anxiety or depression, very often I'll say, have you thought about talking to your GP or psychiatrist? Because we know that medication along with behavioral techniques can be useful. So I know that everyone's not always comfortable with that, but I think it's really important when we're thinking about the brain and how it works, that we recognize that, your chemistry has to be regulated, it has to be dealt with, if you like, and that sometimes you do need a bit more support. The longer the period of mental health difficulty, the harder it is to break that pattern and cycle. So the sooner you get help, the easier it is, to help sort of support you through that. And then I'll also mention mindfulness. There are actions that you can do during the day, which we call mindful. And some people find them that they do help. They sometimes find those easier to access than, say, a relaxation technique, because there's a activity involved. You've probably heard of like mindful coloring, but you can also do things like mindful washing up. And all that mindfulness means is that you're very, very focused on the task at hand. So you're sort of thinking about, what's the temperature? Is something hot or cold on my skin? What's the smell? What does it feel like to wash a cup up in my hand? Can I notice the surfaces? Can I notice the texture changes? And again, if you go onto the NHS website, they actually have a mindfulness course, so you can run through that yourself. And again, what that's doing is that's supporting your prefrontal cortex, it's activating your parasympathetic nervous system. And lots of people find that being present in the moment, again, is a very useful skill to have. The other really important thing to do, if you can, is to push the cancer to one side. None of you are just a cancer diagnosis, and it's really important that as much as possible you spend time away from it, that it doesn't become your life. And that's really, really hard. But if you can create times in the day where you're not focused on it, that's really helpful. Distraction is a good coping strategy, so do utilize it. What we're really looking for is balancing you processing the worries and then giving you some time away, because it's too difficult if all you do is spend your time with the cancer. It's overwhelming. So the only other thing I'm going to add, because I don't want to talk too much longer, is that the other technique which lots of people are finding useful is what we call gratitude. And some of you may have heard like gratitude journals, and it doesn't have to be complicated, but sometimes just recognizing 3 things that have been good in the day or helpful in the day, or that you're grateful for. You can change the language. All we're really doing is trying to recognize the positive things in our day, so that we are sending some positive messages into our brain, and it's not just negative. Our brain very much responds to what we put into it. So if we're putting positive stuff, that's really going to help shift some of that negative thinking. Again, you can do this at the end of the day. Some people find this a lot easier than others. If you're struggling, you can ask people around you, and it doesn't have to be complicated. You know, it could just be, I was really grateful that it stopped raining when I went for a walk, or I was really grateful that I got brought a cup of tea in bed in the morning. And it's just trying to focus on the good stuff as well, because our tendency is to focus on the bad stuff. So we're just trying to shift that as much as possible. So I've run through quite a lot of different stuff there, and I've also run through some of the psychoeducation stuff. So do feel free if you want me to repeat any of that, but I don't want to talk for too much longer, because there's a lot of you, and I want to make sure that we're addressing any specific questions.